My name is Sierra Bragan, and I'm the owner and founder of Miami Moms Blog. And today we are on location at Baptist Health Children's Hospital, meeting with Dr. Fernando Mendoza, who is the medical director here at the Pediatric Emergency Room at Baptist Children's Health. Will you tell us more about flu season? It's approaching, moms are nervous. Give us all we need to know.
Well, Sierra, thank you for having me. It's not approaching, we're here, we're in it. We've been seeing a lot of flu activity for the past probably 3 or 4 weeks now, and really increased about 20% higher and more active than last year's flu season.
So already we're seeing more cases of the flu than this time last year?
Tons of flu, tons of flu. Kids are coming in every single day with lots of flu-like symptoms. Some of them have complications, so it's really important to be aware of these symptoms and the flu activities out there.
Tell us more about the symptoms that you see when you think a mom should maybe have a flu test for her child.
Well, you don't always need a flu test, but certainly when you have a kid who has a high fever, vomiting is a big symptom this year with flu, especially the influenza B strain. Okay, body aches, headaches, feverish, all those are kind of flu symptoms that you can see at any time of the year, but specifically this time of year.
Okay, now is there a certain demographic, children, adults, who are more susceptible to getting the flu?
Well, kids are the most likely to get the flu because they're in tight quarters, at school and daycare, so there's a lot of transmission. So they're more susceptible to getting the flu. The ones who are at most risk are young infants less than 6 months of age or any adult over the age of 65. They can get more complications from the flu.
Okay. Now, moms, I know you want to know, Dr. Mendoza, help us debunk some of the myths associated with getting a flu shot.
Well, the number one myth we have is that you can get the flu from getting the flu shot. That's simply not true. Most of the flu options for vaccines, or flu vaccine options, are all dead virus injections. Okay. Now there are some live intranasal that you squirt up the nose, and those are really recommended for most people. But you have the flu shot is actually dead virus, pieces of virus, that cause a reaction in your body to help it fight any future encounter with the flu. So you cannot get the flu from getting the flu vaccine. Okay. Now, when you get the flu vaccine, for 1 or 2 days afterwards, you may get a little sore, maybe a little achy. That's not the flu. That's your body ramping up its defense mechanisms to fight the future encounter with the flu.
Gotcha. So the symptoms that I may encounter with the shot will definitely be nothing like if I were to get the flu if I choose not to get the shot. So
absolutely
certainly
not.
Worth it.
It's certainly worth it. I mean, being out with the flu lasts 5 to 7 days in most patients, maybe even longer, away from work, away from school, spreading it to young babies in the house, or grandma and grandpa at the house, or it can really affect people who can't afford to get the flu shot. Right. Immunocompromised patients, people on chemotherapy, pregnant moms at times. So there's people who are immunocompromised that really shouldn't get the flu. Shouldn't get sick with the flu, and if you don't get the flu shot and protect your family, you're going to put other people in your family and loved ones at risk.
At risk. Moms, you hear that? You've got to think beyond your own children, but your grandparents, like you said, maybe your child care workers, if you have help in the home, making sure, encouraging your mom friends, if you're doing play dates, those at school, it's just that important. Now, talk to me a little bit about, we're hearing a lot about measles again. I thought it was something that was eradicated back in 2000. Can you speak to that and tell us more?
Yeah, there's been a recent resurgence, especially last year, 2018, 2019, lots of pockets of resurgence of measles. And Miami-Dade County is actually one of the top at-risk measles outbreak areas in the country.
Wow. And what makes us more at risk than other places?
Well, travel. So travel from other countries, Miami being an international hub for travel, makes us more susceptible that if there were to be an outbreak, this would be one of the top 4 places in the United States for it to happen.
Wow. And so tell us, what's the most important thing we can do to protect our family, protect our children from this outbreak?
Well, the answer is vaccination. Now, vaccination with 1 dose of measles in a young child is 93% effective, 2 doses 97% effective. And so herd immunity, when most of your kids or most of the kids in the school are protected with a vaccine, really is what protects the entire community. Now realize that measles is much more contagious than influenza. For every 1 person that gets measles, and it's exposed to 19 or 20 people who don't have the vaccine, 18 or 19 of those will become infected with the measles.
Wow.
So if you're in a room full of unvaccinated daycare or unvaccinated kids in the classroom, 1 kid walks in with measles, that virus can linger in the air 2 to 4 hours in the air.
Wow.
18 of those kids will get sick. Flu, on the other hand, is about 1 to 4 ratio. So for every 1 person that gets sick, they'll infect about 4 unvaccinated people.
So this is imperative. I know my son just turned 1 last week, and so he had this vaccine actually yesterday to be prepared. We want to make sure that he is covered. I'm going to ask the question that I know a lot of moms are thinking about. Again, let's debunk the myths, but There's been talk about this vaccination. Is it linked to autism? Can you share some information with us on that?
Yeah, I mean, there's reams and reams of data, and there's a lot of great studies by the American Academy of Pediatrics, other really well-respected institutions that debunk that myth 100%. Don't get your advice from celebrities and advocates who are not scientists. I mean, there's
Dr. Google moms. No more Dr. Google.
Yeah, and not just that. They're really. I mean, the truth of the matter is, pediatricians. There's no kind of big, big pharma conspiracy or pediatrician conspiracy. I mean, pediatricians are in the business, or really in the passion, of livelihood of taking care of kids. Most pediatrician offices lose money on vaccines. I mean, it's not really cost effective. It's not really a way to make money. And so actually the vaccine manufacturers also having a hard time because it's not really good business to make vaccines. So it's really imperative these vaccine manufacturers are still making it. So there's no big conspiracy theory. It's not a really expensive process, but it's not really, so when pediatricians are giving vaccines, it's not because there's some big pharma conspiracy. So, and it's not that we're have the wool pulled over our eyes. I mean, a lot of the social media or kind of trying to debunk the advocacy for vaccines, are kind of point to that. At the end of the day, lots and lots of scientific studies prove that vaccines are effective. They do not cause autism. Neither does the thiocurmol that's in the vaccines. Even though they've removed most of that from all the vaccines, it's completely false myth.
Truth or myth? If I've already had the flu this season, I don't need the vaccine.
That's not true. You need the vaccine.
Okay.
There are a couple of strains of flu out there. So even if you get influenza A, for example, a few weeks ago, once you're better, you need to get the vaccine because the B strain is out there, and vice versa. I've personally seen in the emergency room cases where kids have come in and had flu a month ago, even this year, and come back with a second strain a second time. So you can get infected twice with different strains of the flu. So it's not true. You need to get your flu vaccine even if you had the flu previously.
Wow. So it's never a bad time this whole season to get the flu shot. Now, when technically is flu season over?
Well, that's interesting. The last year's season lasted about 21 weeks throughout the United States, which is a lot longer than it used to. So for us in Miami-Dade County, since we're kind of a little bit off in terms of like the winters and everything, we actually go all the way through March, April, May into flu season. So anytime, whether it's now, I always encourage you to do it now, get your vaccine now. It's available now before it runs out. But anytime, November, December, get it anytime you can. It will extend past into March and April, maybe May.
Great. And especially, I guess, as families are planning to travel for the holidays, it is airborne, correct? Like if coughing, sneezing, you're sharing that space?
So
is that a myth?
Yeah, that's not a myth. Airplanes use recycled air. And airplane, if you look, it's a big cylinder full of germs. So if one person has measles on a plane and starts coughing and touching everything, that could spread to unvaccinated individuals. Definitely, if you're planning for travel, get your vaccines. Get them early because it takes a couple of weeks for it to really become effective in your body. Yeah.
Okay. Dr. Mendoza, let's talk a little bit more about measles, the symptoms maybe associated, and why is it not just like another virus where maybe it just runs its course and then my kid's fine?
Yeah, great question. Measles can be very, very serious. Actually, in 20 kids will get pneumonia or a complication when they have measles, and about 1 to 2 in 1,000 of kids who get measles will actually die from measles. There's a reason why these vaccines were created. Kids were dying way back when with measles and influenza, and they still do die from influenza occasionally, rarely, but it's really important to understand why we have these vaccines. Now, what to look for. If you think your child has been exposed or is not immunized and has been exposed to somebody or is very young or even an elderly person, high fever is the hallmark. Okay, so anything above 103, 104. A rash that starts typically in the mouth, but after about 5 to 7 days will spread through the body from the head to toe. And kids with measles also have very red eyes, very watery eyes, and they tend to be very cranky and very upset. Yeah. So
do you find that sometimes maybe parents could mistake that for, oh, it's just pink eye, or oh, it's just it's a flu-like symptom?
Well, there are other viruses like adenovirus that cause high fever and red eyes too, and that's a very common virus. It's not really as dangerous or as deadly.
Right.
But if you have any questions, go see your pediatrician or come to the Baptist Pediatric ER. We'll help determine whether it's really measles or not.
Right.
Another really important point is that, and we found out recently, this year in journal Science came out that measles actually wipes out, when you have measles, it wipes out a whole bunch of immunity that your body had built up its whole lifetime. So about 40 antibodies to viruses and bacteria that your body had built defenses to are not wiped out, which is why it puts these kids who have measles later in life to be much more at risk for serious diseases and death.
So much more susceptible to other things just beyond.
Yes, exactly. So all those previous vaccines and protection your body had built up, against germs over the many, many years are wiped out.
So truly, the number one road of prevention is vaccination.
Absolutely. And by the way, I vaccinate all my
That
children.
was my next question.
All 3 of my boys are vaccinated, okay, with measles, with flu, and always up to date.
That was my next question. You took it right away from me. But, you know, heart to heart, moms, we want to share just meaningful information with you. We want to give you trusted resources. And so that's why we go to the source and we get the information for you. So Dr. Mendoza, thank you for your time today. We
Great.
appreciate
Thank you for having me.
so much.
Thank you for having me.
Thank you so much.